Good morning. Good morning. Good morning. Why are only the ladies saying good morning? Thank you. Welcome to the College of Public Health at the University of Georgia's Procrastinators workshop. So this workshop is basically meant to be a very condensed, very fast version of what we typically do at an open house event. It's the tail end of admissions, and so it's hard to get all the resources in regards to faculty and staff to participate in a larger open house event. But what we wanted to do is give people who are interested in still applying to the fall admission cycle for the Masters in Public Health an opportunity to hear about our various concentrations at departments, institutes, and centers, what the admissions process is like, and of course a little bit about what people in the field of public health do. So the way that we are going to do this workshop is we're going to do 15-minute increments, so very, very quick sessions on just the MPH program in general here at the University of Georgia. And then we're going to talk a little bit about careers, and then Lindsay is going to finish it up with a discussion about how the admissions process works for the MPH. We do have several degree programs within the College of Public Health. We are not limited to just the Masters in Public Health. We have doctoral, master's, and bachelor's degrees in various disciplines. But today's session is specifically going to be about the admissions process for the Masters in Public Health. If at any time you do find that you might be interested in learning more about a Master's in Science or PhD or DRPH programs, you are more than welcome to contact me after the presentation via email or come visit me in my office, and we'll have a larger conversation about those other programs. But again, today's focus is going to be on the Masters in Public Health. Does anyone have any questions really quickly before I get started? Okay. All right. So the University of Georgia College of Public Health consists of very many departments, units, centers, and institutes. The people that are mostly responsible for delivering the Masters in Public Health in regards to academic support and student support would be these three individuals that you see on the screen here. Nina Cleveland is our practice coordinator. She is not going to be here today to discuss internship and careers, but she is an integral part of the College of Public Health, and as an MPH student, all MPH students work very closely with Nina Cleveland when it comes to the internship process. She also teaches a seminar on careers in the fall of every semester, helping students work on resumes and CVs, interviewing skills, helping them figure out where they may want to go in regards to their careers, because of course the field of public health is so vast in regards to the various disciplines and types of occupations, and she is a very integral part of offering those services within the college. Lindsay Whitaker is our admissions coordinator, so she works with you before you walk into the doors in August to begin your 2-year MPH program. But she also, once students are here, works as an integral part of our student support services in regards to the events that we hold throughout the year. We do a lot of student-centric events, whether it's a field day or, going out and walking around in a park, whatever it is that we do in regards to events for students to make you guys feel inclusive at the College of Public Health, and also make your graduate experience a very fulfilling experience. Lindsay is a huge part of that support. My name is Mumbi Okundai. I guess I did not say it earlier. Apologies for that. So to introduce myself, I am the MPH director, and I will be talking for the first half hour of today's presentation before Lindsay takes over with the admissions process. And I also failed to mention that the last 15 minutes of each hour is dedicated to students going to the various departments and visiting with faculty members for whatever concentration that you are interested in. If you wanted to visit with more than one faculty member, like let's say you're interested in health promotion and behavior and health policy and management, you can definitely do that, but it's that last 15 minutes that it's dedicated to, so you'd have to keep your conversations with those faculty members a little bit more brief if you wanted to visit more than one. They are all located here on this campus, so they're very easy to get to. And Robert, our student graduate assistant, will help you navigate where you need to go if you do choose to visit the faculty members. For those of you listening online, of course, you would not have that opportunity, but I will be more than happy to connect you with a faculty member within a concentration of your choice if you contact me via email. So just to get started here, very quick introduction on who we are here at the College of Public Health at UGA. Our mission is to promote health and human population across the lifespan, not only in the state, but also in the region, in the US, and globally through innovative research, exemplary education, and engaged service. Our college started in 2005. There were several departments that had been in existence long before the college started, but then once the college formed, they merged into the college, and then we added other departments in order to fill out our core fields and disciplines in public health. We were accredited 3 years after starting by the Council on Education for Public Health in 2009, and have recently been re-accredited in 2014 for the next 7 years. We are one of 18 colleges and schools on the University of Georgia's campus. Until very recently, we were the youngest, so we were considered the babies. But when the College of Engineering came on and started, we have since matured, and we are now that middle child. But that makes us even more aggressive in letting our name stand out at the University of Georgia. And I will talk a little bit more about some of the things that we do that's different than other colleges of public health. The projected enrollment for CPH is about 900 students. Now that 900 is relegated to mostly undergraduate students. About 500 of that number are BS in environmental health or health promotion and behavior. The other 300 are where our graduate students are, with our MPH program being the largest of the graduate programs within the college. Our MPH program has about 160 enrolled students. As I said before, we offer several degrees, undergraduate, master's, and doctoral level. Our newest ventures, and many colleges across the US are doing this, are joint degrees, where you get 2 degrees for the price of 1. As you know, with our economy being the way it is, the more credentialing that you can get and the cheaper you can get it, the better off you may be. If you are interested in some of these joint degrees, I will be very happy to talk with you about them. The important thing to note, however, before we move on, is that some of these joint degrees you have to be in a specific concentration in order to qualify to be in those joint degrees. For example, if you are interested in an MSW and PH, Master's in Social Work and Master's in Public Health joint degree, you can only take those. You can only apply for that degree if it is in health promotion and behavior or gerontology in our college. If you are interested in the Master's of Business Administration via Terry College of Business and the MPH, you can only do that through our health policy and management concentration. So there are some barriers depending on your interest and concentration for doing those joint degrees. Specifically today, we are here, and you'll see to the left in bold, we are here, right in bold, left, I don't know. We're here to talk about the MPH, and it has 7 concentrations: environmental health, health promotion and behavior, health policy and management, epidemiology, biostatistics, and our newest concentrations, the last 2, gerontology and disaster management, began offering MPHs a year ago. So why public health at UGA? So there are several things that make us very unique to other public health programs in the region, and there are very many public health schools, colleges, and programs in the region. We have a local and state mission. As you know, the University of Georgia is the first land-grant university in the United States. Now, University of North Carolina is going to say otherwise, but don't listen to that. So we are the first land-grant university in the US, and that gives us a very very heavy focus on local and state initiatives, whether it's in public health or engineering or medicine or whatever. We have a very local and state driven mission that makes us connected, very heavily connected with not only industry, but also our government, also our nonprofit entities within the region. So that connection and that personal relationship that we have with local agencies and state agencies lets us have an outreach not only in service, but in regards to employment opportunities for our students. We do a lot of research, our core faculty, as well as our service faculty within the university and within the College of Public Health, do a lot of core research in the region. And again, that extends to the students in regards to the relationships that we have been able to foster through the hundreds of years that the University of Georgia has been around. But of course, through the 10 years that the College of Public Health has been in existence. We have a very high quality faculty. All of our core faculty have terminal degrees, but another 15 of our faculty are not only public health practitioners, but also medical doctors. We have a low student faculty ratio. Again, about 160 of our students are MPH students. That means we have a lower class size than a typical MPH program. If you have researched any of the other MPH programs around the area, some other MPH programs range from 500 to 1,000 to 1,500 incoming students. Yeah. So our lower student number allows for our students to have a very personal relationship with faculty members. We have 62 core faculty, so it gives us a really, really low MPH student faculty ratio of about 18 to 1 for some of our higher demand concentrations, and goes down to about 8 to 1 for some of our lower demand concentrations. So that gives students the opportunity to really, really get to know the faculty members, and those small class sizes afford students the opportunity to really talk intimately with each other and with faculty about the various research interests that they have, about the field, and about their own particular curiosities in public health. We have a very diverse student and faculty population. About 35% of our students, and that's creeping up into 40% of our students, are from underrepresented groups. And then we have about 12% of our, 7% of our students are international students in the MPH program. That doesn't seem like a very high number, but it does fall in line with the university's number, and our diversity numbers are actually higher than the University of Georgia as a whole. And our diversity numbers actually mirror very closely the Georgia population, so the population for the state of Georgia. That means that to us, our outreach and our recruitment efforts are really reaching some of the underrepresented groups that don't typically get that outreach from other institutions. We are a very affordable program compared to many other state and private programs within the region, coming in at about $6,500 per semester for a full-time student for tuition, and coming in at just under $400 per credit hours for those who wish to attend part-time. We are talking about one of the lowest cost MPH programs, not only in the region, but in the nation. If you were to apply as an out-of-state student from many other institutions, you're talking about doubling, tripling that fee, even if it is a state institution. When you talk about going into private colleges for masters in public health, you're talking about quadrupling that cost. We have an incredibly high graduate retention and graduation rate, and we are very, very proud of that. Our graduation goes from 89 to 92%, depending on the incoming cohort, that graduate within 2 years with a master's in public health. So we don't hold our students back. We don't keep them longer than they need to be. We make sure that they complete their 45 credit hours within the 2 years, if not shorter, in order to keep that cost down, as well as to get you out into the workforce in a much faster rate or as fast of a rate as you wish to partake. We are accredited. We are accredited by the Council on Education for Public Health. All schools that offer offer courses and specialties within the 5 core areas of public health are considered schools or colleges of public health. That is very different than a program for public health, and it's very important that students are aware of the differences between a college or a school and a program for public health. So I'll give you just an example. There are many programs that may focus in global health, or let's say maternal and child health. Now, if their main focus is that area and they don't offer the other key disciplines within the field to sort of round off that public health education, they are considered a program. Not to say that there's anything wrong with the program, but that is very different than a school where those 5 core areas of public health are required and students are mandated to exhibit some level of competency within those 5 areas. Being accredited allows degrees to be nationally recognized in the field. So having an accredited MPH from the University of Georgia means that you can go out and have a degree that is nationally recognized. And it emphasizes a competency-based education for not only the MPH, but for all of our other doctoral degrees, which means that we really do hold the education that our students receive to a very high esteem. And because people come in every 7 years and make sure that we are on par with what we need to be teaching you, the research that we are conducting, the services and outreach that we provide, we make sure that we are constantly on our P's and Q's in regards to providing that education, service, and outreach. And of course, being in a CEEP accredited schools allow for various funding opportunities that are not extended to non-accredited institutions. And it also allows you to sit for the national CPH exam where you become credentialed to be a certified public health practitioner. So just to get into a little bit of what we are specifically, does anyone have any questions before I move on? I know I'm going kind of fast here. We have 5 academic units, but 4 departments and 7 concentrations in the College of Public Health. See if you can keep up with that. Our 5 academic units are Epidemiology and Biostatistics, which are in 1 department. Environmental health science, health policy and management, and health promotion round off the units. And I will just very briefly talk about what it means to be in any of these concentrations, because I know a lot of you guys have the basic question of what concentration do I want to apply for? And while some schools will allow you to apply for any concentration, we do relegate it to just 1 concentration. So you got to be really focused in regards to where you want to be with your MPH upon applying to the MPH program for us. So biostatistics, if that table meant anything to you, then you are on par for our biostatistics program. Now, I don't know if it actually means anything at all, but let's assume that it does. Biostatistics is the collection, storage, retrieval, and analysis and interpretation of health data. Biostatistics is very much focused on how a research study is designed and the data that comes out of that study. And the analysis of that data really does drive what we do in public health. So biostatisticians are a core part of any field of public health, any discipline in public health. But they do focus primarily on the design and analysis. There's a lot of data mining, a lot of design and data interpretation that happens within biostatistics. There are no prerequisites for the biostatistics concentration, but they do look very heavily at the quantitative GRE, as well as the math and science courses that you have on your transcript, more specifically the math courses. If you have a lot of statistics, a lot of linear algebra, calculus, those types of courses, and you perform very well in those courses on your transcript, you will be in line for the biostatistics concentration. Epidemiology is the study of the distribution and determinants of disease and disability and death in human populations. Epidemiologists develop and evaluate hypotheses about the effects on human health of hereditary, behavioral, environmental, and healthcare factors, and they develop a knowledge basis for disease prevention and control. So while biostatisticians look at the numbers, epidemiologists look at how that design is made, and they look at what types of survey instruments you're working with, what data you're actually looking for, what are the determinants of particular diseases or disabilities, are what epidemiologists look for. If you are interested in research, epidemiology is the place for you. If you are more interested in human interaction and working with populations, then epidemiology may not necessarily be the field that you want to go into. Many students go into epidemiology thinking that it's one way, but really it is very, very research heavy. And again, there are no prerequisites for our epidemiology concentration, but very similar to our biostatistics department, they look very heavily at the quantitative GRE, and they also focus a lot on the math and science courses, much more on the science courses than our biostatistics department, biostatistics faculty do. So if you are very strong in those areas on your transcript, then epidemiology will be something that will be easy for you to apply. Some of the areas of interest for our biostatistics and epi faculty are included on this slide: infectious disease modeling, environmental statistics, spatial epidemiology, molecular epidemiology. And it's important to note that these two concentrations are in the same department because they work very closely together in what they do. Environmental health science is the study of the impact of the environment on the health of humans and other species. And as David A. Schwartz, the former director for the National Institutes of Environmental Health within NIH, stated, almost every complex disease from diabetes to obesity, heart disease to many cancers is in part caused by exposures from the environment. So environmental health scientists not only look at how water or air affects our environment, but also how we personally interact with those environments and how negative impacts on those environments can negatively impact our health. Environmental health science is the bench science within public health. So all EHS students are required to have a very strong background in bench sciences and the hard sciences. There's a lot of lab work that is required with environmental health science, and you just work in wet labs a lot. And so if you have a very, very strong science background, then EHS is going to be the field for you. They do have specific prerequisites, and having that strength in biology and chemistry and even going up into organic chemistry is a very good idea if you are interested in the environmental health science track. And this is just some of the areas of research. All of our concentrations work very closely together. So with a lot of these slides, you'll see things that look to kind of go interdisciplinarily from one concentration to another. So for example, a lot of our environmental health science faculty work in environmental epidemiology. It's just an example. But some other things, environmental microbiology, we have an entire toxicology program within our environmental health science department where they have PhDs and MSs in toxicology. So that's a huge focus for our environmental health department. Health promotion and behavior. If you like working with people, health promotion and behavior is the place for you. So health promotion and behavior is where we work not only on infectious disease prevention, such as the spread of HIV/AIDS, but we also work a lot in health promotion and behavior on preventive behavioral indicators or things that you do that could negatively impact your health. So as you can see, in the last 115 years, we have gone from causes of death and disease being mostly attributed to things in our environment that we could prevent in environmental ways. We improved sanitation, we improved medical innovation so that we could stop the spread of infectious disease. But now we've gone into our big indicators of negative health being our own behavior. So, smoking tobacco, unprotected sex, poor nutrition, and bad eating habits are all contributing to these high negative impacts on our health, and health promotion and behavior works very, very hard to try to promote positive health and prevent negative health outcomes through our behavior. Some areas of faculty research within our health promotion and behavior department are worksite health promotion, school violence prevention, injury prevention, traffic safety. We work a lot in HIV/AIDS prevention and cancer prevention as well. Health policy and management. Now, we all know that the price of healthcare has skyrocketed exponentially in the last 100 years, right? Nobody can afford healthcare. We are all very concerned about our healthcare future. We are worried about Medicare solvency. We are worried about being able stay healthy and our children being able to stay healthy through their lifespan, and health policy and management focuses a lot on that. So their primary focus is a study of healthcare delivery systems and their impact on our public health. And this includes quality of healthcare, the management of healthcare organizations, hospitals, clinics, and other healthcare delivery systems, and health financing and insurance. Some of our faculty focus, research focus, include health consumerism, health outcomes, economics and policy. Economic evaluation and program evaluation is a big part of health policy and management, and just the management of healthcare organizations or public health organizations as well. Disaster management is our newer, well, the Institute for Disaster Management has been around, but our MPH in disaster management, as I stated earlier, is one of our newer MPHs. The Institute for Disaster Management is a team of internationally recognized experts in fields such as emergency management, weapons of mass destruction, disaster modeling, and public health. It's important to note that our disaster management team are at the forefront of accreditation of our hospital system in the state of Georgia. So all 100 and I believe 69 of our hospitals and clinics, our disaster management team goes and assists in their accreditation and their emergency plans. So they are very, very busy out in the state and out nationally. Whenever there's a natural disaster that happens, our disaster management team goes out and takes care and, you know, helps out in the organization of the relief management. Our next one, gerontology. Gerontology is a field dedicated to finding solutions to the challenges of an aging society and serving the needs of all Georgians. Gerontology is the study of aging, basically, but it also is a study of aging throughout your lifespan. So while it is important to note that we do mostly focus in gerontology on the 55 and over population, there are a lot of gerontological issues that begin at much younger ages. So they really do study the lifespan in the Gerontology Institute. Now, not only do we have the 7 MPH concentrations, but we also have several certificates that students can get in conjunction, in addition to, and at the same time as their MPH program. Certificates do not extend your time in the MPH program, so if you are dedicated to getting out of the program in a year and a half or 2 years, adding a certificate or 2 to your program does not extend that time. There are 3. We have a global health certificate, a disaster management certificate, and a gerontology certificate. So let's say you decide that you want to focus on epidemiology with your concentration, but you are still interested in issues on aging. You can grab that gerontology certificate in addition to your MPH and epidemiology. So that's just an example of how you would do the certificate programs. Students may be admitted to the graduate school and through an academic department to get a certificate, like you're doing the MPH, and then also getting a certificate, or you can come in as a non-degree seeking student and get a certificate. So you don't have to be going towards the MPH in order to get one of these certificates. So just very, very, very quickly, the MPH curriculum is a 45 credit hour curriculum. You are required to take 1 course from each of the 5 core public health areas, health promotion and behavior, biostats, environmental health, epi, and health policy. That's 15 credit hours within that 45. There are 3 or more additional courses that are required within your concentration area, and those courses are determined by your department, by your concentration. So if you're in epi, you're taking very epi-specific concentration courses. If you're in gerontology, you're taking gerontology-specific, etc. There are additional electives that students are required to take in order to specialize more in a very specific area within their concentration. And then there's a 1-hour seminar that every student is required to take, where they sit and listen to practitioners and researchers out in public health discuss what they're doing out in the field, help students better relate to their curriculum. To round off the MPH curriculum, there's a 6 credit hour internship, and it is 300 contact hours within a semester. You can do it either summer, spring, spring, or fall. Depending on the concentration, you would either do that in the middle of your curriculum, or you would wait until the very end of your curriculum. So it depends on which concentration that you're in. And then to round off the curriculum, you are required to do a 3-credit-hour capstone project that can take on various forms. It can be a public health culminating project. That would be a paper that encompasses all of the things that you learned in the core areas of public health, but very much centric to your concentration. It could be a publishable article that you would begin working with a faculty member long before the semester that you start your capstone, but it finishes up that last semester of your capstone. A lot of faculty members are becoming more and more interested in students doing this publishable article route, especially students who are interested in going on into furthering their education at the doctoral level. There's also a thesis option where you, very much like an MS program, you would pick a very specific topic within your concentration, and you would become, so to speak, an expert in that particular field with that master's thesis. So there's several ways that a capstone project can look. The total credit hours, when all of this is said and done, is 45 credit hours. And again, we graduate most of our students within 2 years of that 45 credit hours. Most of our students are traditional students going from undergrad straight to grad school, or taking a break somewhere in the middle and then coming to do grad school full time. We don't have very many part-time students, but part-time is an option for the MPH program. Of course, we have various international opportunities, not only through our Center for Global Health, but many of our faculty are have very specific areas that they go to do their research, and they welcome and actually offer courses through their research in those areas for students to go along with them. We've got 2 faculty members that have ongoing research and courses in Costa Rica at our UGA Echo Center. Students go there every summer. We've got faculty members doing research in Peru on indoor air quality and also reproductive health. We've got researchers working in Uganda on HIV, AIDS, and tuberculosis prevention. We've got researchers going to Israel and working on the public healthcare infrastructure in Israel. Israel has one of the strongest public health infrastructures in the world, and so our students who go there really get a hands-on approach, a first look at what it means to have a really strong public health infrastructure that you can implement in other parts of the world. So we have faculty members that take students all over the place, but our internship opportunities as well, for those who do a global health certificate or for those who are just interested in getting some international experience, have the opportunity to do international focus internships. And if you start looking early, that is not an impossibility. We've had students go to the World Health Organization. We've had students work through USAID. We've had students do several international opportunities who are very interested in doing that global health perspective in public health. These are just some pictures of our wonderful students and their academic life and how that bleeds into their social life. There are various events that we put on throughout the year. We have a public health association, and our graduate assistant, Robert, here is the president, actually, of our public health association. They have a lot of events that they put on throughout the year. But not only that, but they also help students with funding for conferences, and they put on a big group together to go to the annual public health Public Health Association meeting. I don't know why that lost me. This year the meeting's going to be in Chicago in November, in the beginning of November. So they help students figure out how to get up there, especially those students who are going to be presenting. So Public Health Association does a lot with our students in regards to not only social but outreach efforts. Funding your education very quickly. Graduate teaching and general research. Graduate teaching, research, and general assistantships are offered through the college and through the departments. Most have early application deadline, and most of those, by the time you get to this point in the year, have already been taken up. Once students are in our program, they have opportunities to seek funding or continue to seek teaching and research assistantships through the departments and individual faculty members. And there are many students who do get those opportunities once they are students. But that requires a lot of gumption. That requires a lot of perseverance on the student's part. Again, at this point in the application deadline, a lot of the internal funding has already been distributed to the academically competitive students. Scholarships are out there. The application deadline for most scholarships for the following year tend to be between September and November of the previous year. So if you're talking about coming in the fall of next year, you need to start now looking for those funding opportunities, and those applications tend to open around September or October. If you're looking for funding for this year, you may have already missed the boat on a lot of the external funding opportunities, but there are some last minute things that come up. I always encourage students to look at the University of Georgia's website and just do a generic internal search on assistantships to see, because some departments, the money comes in, some faculty member gets some new research grant, automatically needs some new graduate assistants, etc. So things like that do happen, but I encourage students to be very tedious and very self-motivating in looking for funding. Looking for funding is very much like looking for a job. There's application processes for a lot of these things. There's nominations, there's blackout periods where you can't apply for these things. So it requires a very ongoing process of looking for them. And then, just very, very quickly, there are various career titles within the field of public health, and this is just some of the descriptions or titles of our MPH graduates who have gone out into the field as research scientists or health communication specialists, environmental health intelligence analysts, data and evaluation specialists. So these are just some of the titles of our MPH graduates. Some top employers in public health include, of course, the Centers for Disease Control and Prevention over in Atlanta. Every state and every community is required to have a public health department. That is where a lot of data gets collected, stored, mined, and analyzed and written. That is where we get a lot of our public health information that goes out to local, state, and national agencies. So the state and local public health departments have to have a very strong and large personnel, and public health MPH students, MPH graduates are prime and key to how the operations happen at the state and local public health departments. The National Institutes of Health and academia are big pillars of public health practitioners. Hospitals and medical facilities, managed care organizations and corporations, and of course, local, state, and national nonprofit agencies are all big employers in public health. So some of the lower ranges here in these disciplines include our bachelor's graduates. A lot of students who graduate with a bachelor's degree in public health do actually go out and practice public health. The master's level tends to be in the median range of these ranges, and then the upper range tends to be those who have a lot of years of experience in public health, or those who go on and receive doctoral degrees. But it's not only just employment that you can go and seek after your MPH. A lot of our students go on and do fellowships, whether it's a fellowship through the CDC or a fellowship through an international organization. A lot of our students do go on to academia. About 18% of our MPH graduates from the previous cohort went on to further their education, whether it was a DRPH or PhD program. Overall, about 87% of our students either got employment at 70%, 70% went on to employment, and then the other 17% went on to either academia or fellowships and other programs past their MPH. So we have a very, very high placement rate for our graduates. And we will have these slides available on our website. So if you want to see where our graduates have gone, I do not have a lot of time to do that now. Okay. Let's see if it's going to open. Yeah. I do not have a lot of time to go over it now, but if it pops up, I'll just show you where you can get to our graduate survey, and you could see where our students have gone and what their titles are. Well, let's see here. Maybe I can do it. Okay, never mind. Does anyone have any questions? No? Okay, so Lindsay Whitaker is going to come and she's going to quickly cover the admissions process for our program.
All right, good morning. My name is Lindsay Whitaker and I'm the admissions coordinator. So when you're getting ready to apply, as you're applying, I'm going to be your point of contact if you have any questions. So I'll very quickly go over the admissions process. Okay, good. So we don't have any recommendations we don't have any requirements for the admissions process, but we do have recommendations as far as what you might want to shoot for in order to be competitive. We recommend that your GRE scores be in the 60th percentile in each of the sections. So your verbal, your quantitative, and then your analytical score be about a 4.0. We also recommend that you have a 3.0 out of 4.0 on a 4.0 grading scale for your GPA. Has anyone already started the application process? Not yet? Okay. Well, applications are still open. We're still accepting applications, so there's plenty of time. We require 3 letters of recommendation, so make sure you get into contact with your professors, or if you've had internships, anyone you feel like is going to write a really strong letter of recommendation for your professors. Make sure you're talking to someone who knows how you are as a student. That's what our faculty like to see. Go ahead and get in contact with them to let them know that they are going to need to submit a letter for you. We'll also take your resume, and then of course your statement of purpose is going to be part of your application. So there is a 2-step application process, 2 separate applications that you have to complete. The first being the graduate school application. This is really just a means of getting you into the UGA record system. The faculty aren't actually going to look at anything in your graduate school application. So just submit all of your basic information. It's going to ask you for an email address for whoever wants to submit your letter of recommendation. If you have a dummy email account, or just put your own email address in there just to advance past that part of the application, because it won't let you skip that. Your letters of recommendation are going to be submitted with the application that we will talk about on the next page. So these letters of recommendation with the graduate school are not going to be looked at. They're not required. Your transcripts are not required until you have been admitted, and then UGA has to confirm that you got your bachelor's degree. So you need to send in your final transcript at that point. Your official GRE scores, we can get that from your SOFIS application, and there is a separate application fee for the graduate school. It's currently $75 for domestic applicants and $100 for international applicants. And their deadline is July 1st, so make sure you complete the graduate school application by July 1st. And this is the much shorter application because, again, it's really just to get you into the student record system. So the one you're really going to want to take your time on is the SOFIS application. This is the one that the faculty members are going to look at. They're going to read your statement of purpose through it, your resume if you submit that, and this is where all 3 letters of recommendation are going to be. These are also electronic forms, so make sure you get a current email address for whoever is writing your letter, and make sure you let them know to expect an email. It will email them a link to the electronic form, and they can go online to submit that. This is also where you need to send your GRE scores. The code is 8345, so make sure you select that so that SOFIS gets your scores. And then you also need to send all of your transcripts to SOFIS. This is really important. Anywhere you've taken undergraduate or graduate coursework, you need to make sure that transcripts get sent to SOFIS. Otherwise, they won't complete your application, they won't evaluate all your transcripts, and they won't send it to us. So it's really important that you have a completed application because, as you can see, our faculty can only review completed applications. So if you took dual enrollment coursework during high school, you may have forgotten about that because it's been a while since you took it. You still have to send that transcript in, excuse me. So just make sure that you are sending all of that in. And then the application fee, again, is $120 for SOFIS. Now, this application you can start and then come back to, so please feel free to start your account, start going through the application. If you need a break, log out and come back to it, the next day. It does take about 4 weeks to complete your application, get all your letters of recommendation in, assuming that they're submitting them in a timely fashion, as well as for SOFIS to evaluate your transcript and for you to get a decision. So just keep that in mind as you're starting the application process. Are all of you thinking about this fall, or is anyone thinking about fall of 2016? 2016, okay. So the deadlines for our general deadlines for the early application are it's January 5th. So if you want to be considered for assistantships, make sure you apply by January 5th. And then the regular deadline is April 1st. That's a soft deadline. Obviously this year we're still accepting applications as long as space is available. We'll still accept applications. All of this is on our website as well. So all of those deadlines are published online. If you have any questions throughout the application process, if you need help with anything, please feel free to contact me. My direct email address is online. You can email me there, or you can just email mph@uga.edu. I check that account. If you have any program questions or questions about anything else that was mentioned today, Lundy's information is here as well. Really quickly, before we end, does anyone have any questions about anything we discussed? I'll go back to the line. Anyone have any questions about? Yes.
How long is the MD MPH program?
So it starts at the MD side. Students have to apply and get accepted to the MD program. GRU is a partner that we work with for that program. And in the first year of the MD program, students then apply to the MPH side. You have a breakout year right before you graduate with your MD. So it takes about 3 years before we even, well, we start to see you in about your second year. You take 1 or 2 courses here and there. And then you have a breakout year when you do all your MPH courses in 2 semesters. And then you go back and you finish up your MD program. So depending on how long that program is, it kind of determines how long the MD MPH is.
And we can accept MCAT scores instead of GRE.
Okay, we do.
Just make sure you contact me when you're getting ready to send this.
Yeah. And just like with the MD program, our MBA MPH program, we do accept the GMAT. If you want to take that in lieu of the GRE, we will accept that as well. And for those interested in the social work dual degree, the social work program does not require the quantitative GRE as an application process. So many of the social work students will skip through that part of the GRE, but where they get stumped is that we do. And our HPRB and gerontology faculty look really heavily at both parts of the GRE. So I recommend, it doesn't even matter if you're applying to UGA or not. If you're going to take the GRE, focus very heavily on both parts of the GRE. Yes,
I
ma'am.
already been accepted to the MS study program. Would I need to pay that $75 UGA again?
I think it's reduced for students who have already.
It is reduced. So there's the second major fee and the third major. I think it's around 40 for the second and it goes down from there, but it is reduced when it's your second major.
Are there any other questions? And for the dual degree students, you can get accepted into, with the exception of the MD, Beckman, and PharmD programs, you can get accepted into any of the programs first. So you can get accepted to Terry and then apply to us. You can get accepted to us and then apply to the School of Social Work. So for example, you've already been accepted to School of Social Work. You can now apply to us, but you have through the first semester of your first year. So even if you're still kind of questioning if you're interested, as long as you decide that you are interested by October, you have until November 15th to get your application. So then we would accept you for the spring. So for the dual degree students, we do have spring admission. So you do have that first semester to kind of think about whether or not you can handle the additional burden on the coursework, etc. We do not have spring admissions for any of our other MPH concentrations, only the dual degrees. Okay. Are there any other questions? And for you guys online, please feel free to email Lindsay or myself if you have questions after this live stream. mph@uga.edu is where you would want to direct those questions. All right, thank you all for coming. And now, any of you who are interested in taking our faculty